Blood pressure is a measure of the force that your heart uses to pump blood around your body. High blood pressure, also called hypertension, is a common disease that occurs when the pressure in your arteries is higher than it should be. Having high blood pressure increases your risk of heart attack and stroke, so knowing your blood pressure could save your life. So in this video, we're going to discuss high blood pressure and your health. The video is going to be amazing, so make sure you stick till the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Blood pressure is the measurement of the pressure or force of blood pushing against blood vessel walls. When you have hypertension, high blood pressure, it means the pressure against the blood vessel walls in your body is consistently too high. High blood pressure is often called the silent killer because you may not be aware that anything is wrong, but the damage is still occurring within your body. When the heart squeezes and pushes blood into the vessels, blood pressure goes up. It comes down when the heart relaxes. Blood pressure changes from minute to minute. It's affected by activity and rest. Body temperature, diet, emotions, posture, and medicines. More than 80 million Americans, 33%, have high blood pressure, and as many as 16 million of them don't even know they have the condition. If left untreated, high blood pressure greatly increases your risk for heart attack and stroke. Hypertension is projected to increase about 8% between 2013 and 2030. High blood pressure damages the walls of your arteries. This makes them more likely to develop deposits of plaque that harden, narrow, or block your arteries. These deposits can also lead to blood clots. Blood clots can flow through your bloodstream and block blood flow to your heart or brain, resulting in a heart attack or stroke. There isn't always an explanation for the cause of high blood pressure, but most people develop high blood pressure because of their diet, lifestyle, or medical condition. Sometimes high blood pressure runs in families and can also worsen with age. People living in deprived areas are at high risk of having high blood pressure, and it's also more common if you're of Black African or Black Caribbean descent. Even in these cases, you may still be able to improve your blood pressure by changing your diet and being active. High blood pressure is often related to unhealthy lifestyle habits such as smoking, drinking too much alcohol, being overweight, and not exercising enough. High blood pressure is more common in Black American adults than in white or Hispanic American adults. Having a family history of high blood pressure increases your risk as the condition tends to run in families. The more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the volume of blood circulating through your blood vessels increases, so does the pressure on your artery walls. Obesity, especially abdominal obesity, also increases stiffness in arteries, which raises blood pressure. People who are inactive tend to have a higher heart rate and higher blood pressure than those who are physically active. Not exercising also increases the risk of being overweight. High blood pressure complicates about 10% of all pregnancies. There are several different types of high blood pressure during pregnancy, and they range from mild to serious. Since high blood pressure doesn't have symptoms, your healthcare provider will need to check your blood pressure with a blood pressure cuff. Providers usually check your blood pressure at every annual checkup or appointment. If you have high blood pressure readings at 2 appointments or more, your provider may tell you that you have high blood pressure. If high blood pressure is due to a condition like a kidney disease or lung disease, treating it might be enough to get the blood pressure back to normal. Doctors also might recommend lifestyle changes. If you have hypertension, your doctor might want you to eat more fruits, vegetables, and low-fat dairy, limit salt, avoid caffeine found in sodas, tea, coffee, and energy drinks, and avoid alcohol. Blood pressure readings measure the 2 parts of blood pressure, systolic and diastolic pressures. Systolic pressure is the force of blood through an artery when the heart beats. Diastolic pressure is the force of blood flow within the blood vessels when the heart rests between beats. A blood pressure reading measures both the systolic and diastolic forces, with the systolic pressure listed first. The numbers show your pressure in units of millimeters of mercury, millimeter mercury, how high the pressure inside your arteries would be able to raise a column of mercury. For example, a reading of 120 by 80 mm mercury means a systolic pressure of 120 mm mercury and a diastolic pressure of 80 mm mercury. Most doctors don't make a final diagnosis of high blood pressure until they measure your blood pressure several times, at least 2 blood pressure readings on 3 different occasions. Some doctors ask their patients to wear a portable machine that measures their blood pressure over the course of several days. This machine may help the doctor find out whether a patient has true high blood pressure or what is known as white coat hypertension. White coat hypertension is a condition in which a patient's blood pressure rises during a visit to a doctor when anxiety and stress probably play a role. The good news is that your doctor can identify high blood pressure with regular checks. If found, it can be successfully treated using a combination of medication and heart-healthy lifestyle changes, or sometimes lifestyle changes alone. Making small changes to your habits, such as eating a lower sodium diet, getting regular exercise, maintaining a healthy weight, limiting alcohol intake, and quitting smoking, can lower your blood pressure by 10 to 20 mm mercury or more. And if your doctor has prescribed blood pressure medication, it's important that you take it as directed. Taking high blood pressure seriously and following your doctor's treatment instructions can lower your risks of serious complications and make a big difference in your overall health. If you have uncontrolled high blood pressure or think you might be at risk, schedule an appointment with your primary care provider today. Medication that you take to control other health conditions such as arthritis, epilepsy, or allergies can cause your blood pressure to rise. Such medication can also interfere with the ability of antihypertension drugs to keep blood pressure down. Common pain and anti-inflammatory medicines can lead to the retention of water, which can create problems with the kidneys and higher blood pressure. Adults should have their blood pressure checked at least once a year. Many grocery or drug stores have blood pressure machines that you can use for free anytime you visit the stores. Keep in mind, though, that these machines may not give you a correct reading. Blood pressure monitors for use at home can be bought at drugstores, department stores, and other places. Again, these monitors may not always give you a correct reading. You should always compare your machine's reading with a reading from your doctor's machine to make sure they're the same. Remember that any measurement above normal should prompt a visit to the doctor, who can then talk with you about the best course of action. The amount of time it takes to lower blood pressure varies depending on how high your blood pressure is and the aggressiveness of your treatment program. Medication can help lower blood pressure quickly, usually within a couple of days, but because of potential side effects, a long-term aggressive medication regimen may not be sustainable. Your doctor will prescribe lifestyle changes to lower your blood pressure too. Studies show a healthy diet and regular exercise begin to make a significant impact on blood pressure levels within 3 weeks. Most people who have high blood pressure will likely need lifelong treatment to help ward off or delay serious health problems brought on by the condition. Options to treat high blood pressure may include eating a healthy diet with less salt, taking medication, and incorporating additional lifestyle changes. These include exercise, limiting alcohol intake, smoking cessation, and managing stress. According to guidelines from the American Heart Association (AHA), the American College of Cardiology (ACC), a reading below 120 by 80 mm mercury is classified as normal blood pressure. Those with a blood pressure reading anywhere from 120 by 80 up to 129 by 80 are classified within a category called elevated blood pressure. Hypertension is defined as a reading of 130 by 80 or higher. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe and we'll be back soon with another video.